Anticonvulsants, Anti-Parkinsonian drugs, and agents for Alzheimer's disease lecture. Diseases and disorders that you should be familiar with. Seizures. There's grand mal and petit mal type seizures. Seizures are abnormal neuronal discharges in the brain. Epilepsy are recurrent seizures of unknown nature. About 40% of patients have these types of seizures. Parkinson's disease is a lack of dopamine in the brain or a decrease of dopamine in the brain. This disease causes tremor, rigor, shuffling in stance, and generalized slowness of movement. Restless leg syndrome is throbbing, pulling, creeping, cramps, or leg pains. Alzheimer's disease is a slow and progressive type disease that affects the white matter in the brain, causing memory loss. Anticonvulsants. Used to reduce the amount and the severity of seizures in patients with epilepsy. There are two categories in this medication. There's the first generation, which requires serum blood monitoring. These types of medications do need to be titrated. Titrating means slowly increasing the medication amount until the effect is carried out or until it is not tolerated. The second generation is superior in efficacy compared to the first generation. That's why we use the second generation more. You will see those more often in the clinic. There's fewer adverse reactions. They do not require serum blood testing, and they do require slow titration, just like the first generation. So anti-seizure, anticonvulsants. Here's a little cartoon for you. First generation, Dilantin and Tegretol are the most common. Dilantin reduces the voltage, frequency, and spread of electrical discharges. Tegretol reduces the synaptic reaction, and then luminol is actually a second generation, works like a circuit breaker in seizure activity. With these, you will want to watch for gingival hyperplasia, which we will talk about in a few slides, and bradycardia. Tegretol, you will want to watch for visual problems, ataxia, and vertigo, and then the phenobarbital, drowsiness and dependence. Phenobarbital is a barbiturate which can cause to confusion, excitement, and restlessness in elderly, and can be habit forming. So we do not see this drug quite as much. I would say the Dilantin is the most common, and then the Tegretol would be second. Tegretol, stop the seizures before they start. That's kind of the way of thinking with taking this medication. People take this prophylactically to protect a client with known seizures, and can be taken for pain for certain neuralgias. We need to watch for drowsiness, nausea, vomiting, blurred vision, and headaches, and don't give medications with grapefruit juice. So second generation anticonvulsants, this is gingival hyperplasia. This is an example on this slide. Patients need to be very careful when brushing teeth and have careful oral hygiene while taking these types of medications. Second generation anticonvulsants can also be given to treat other disorders. So gabapentin and Neurontin is very common in treating neuralgias or nerve type pain. Lamotrigine or Lamisil also is used to treat bipolar disorder. And then Keppra, topiramate or Topamax is also sometimes used to treat migraines when other medications do not work. It's very important to teach patients about patient education with these medications, so careful oral hygiene, like I said, and then take with food or milk. And then also to wear bracelets to let people know, that you do have a history of seizures. Anti-Parkinson's drugs. So dopamine replacement. The carbidopa, levodopa, also called Cinnamate. The levodopa crosses the blood-brain barrier where it is converted to dopamine. Carbidopa enhances the levodopa. There is also a dopamine antagonist, which delays the onset of levodopa. Such drugs are Mirapex and Requip. Patients that are less than 60 years old may be on this just as monotherapy, but there are some cautions. This medication may cause intense urges such as spending money, gambling, increased sexual urges, binge eating, those types of things. So we need to have patients report those types of behaviors, or patient families report those types of behaviors when seen. MAOB inhibitors are used when Cinnamate is less effective. They help break down the dopamine in the brain, usually an adjunctive therapy, meaning that is usually taken with another type therapy for Parkinson's. Anticholinergic agents help with tremors. Cogitin is very common in the early stages of Parkinson's. Amantadine alters the dopamine release, and the COMT inhibitors increase the concentration of the levodopa and dopamine in the brain. Cogitin controls the uncontrollable, so it can be taken PO, IM, or IV. Usually IM or IV is used when dystonia is present. Is a complete loss of muscle movement because they have the tremors and the rigidity. Cogitin selectively blocks central cholinergic receptors and balances dopaminergic activity to reduce severity of symptoms. Restless-like drugs. Treated with Mirapex, Requip, the Nupro patch. Gabapentin is usually a second-line treatment for restless legs, not very commonly used. This is only used if there's continued sleep disturbances. Usually these types of medications are taken 1 to 3 hours prior to bedtime. And Alzheimer's disease. There are two categories. There's the cholinergic inhibitors, which is the donepezil or Aricept. And then there's the NMDA receptor antagonists, which is the Namenda. They delay the progression. They do not cure Alzheimer's disease, and they help maintain daily function for a longer period of time once a patient is diagnosed with this disease.